In May this year, psychiatric patients at the Life Esidimeni mental institution in Randfontein had to be relocated. This was due to the termination of a contract between the group and the provincial health department, but the process was marred with tension as government was accused of not informing the relatives of the patients about the move. The MEC for Health here in Gauteng, Qedani Mahlangu, joins us here in studio to talk about this. MEC, thank you very much for being with us here on the program.
Good morning, Leanne, and good morning to the Morning Live viewers.
Let's just, before we talk about what's been happening in the relocation, why was the contract between the department and Life Esidimeni terminated?
Firstly, we terminated the contract in order to respond to the national legislation that says we must decentralize mental health treatment closer to communities and also to move away from institutionalization of mental healthcare patients so that they can be rehabilitated and integrated back into communities and be surrounded by their loved ones. Secondly, the cost per patients were increasing per annum, and we could no longer be able to afford to go above 10,000 rand per patient in keeping the government patients at life, because we were referring those patients from our hospitals to Life Esidimeni in the first instance.
Yeah, I mean, at the time there were calls, and I know we did an interview with it, saying that a lot of the families were never informed. They didn't know where to go, what to do, where the process was. And in fact, now there's still even complaints where they're saying that patients are actually missing at this point, and they're not in any institutions.
It's just to put it on record, Leanne, is that I think it will be irresponsible on my part and the part of the department to do anything of such. I have been in meetings at Way Valley with somewhere outside of Germiston. I met with the family. The hall was packed. I addressed the families. In that meeting, we also established a small committee to engage with the families, also to go around and view the places together. Secondly, the weekend thereafter and of the same week, the HOD, together with other senior managers, went to the West End to meet with the families. Also, they had extensive engagement with them. And again, another family committee was established after that. Our mental health review board, who also many of them are psychiatrists by training and profession, whose responsibility is to ensure that there's ethical treatment of this patient from medical care. We're part and parcel of engaging with the families. So I'm not sure exactly who did we not consult, because when we said we met with the families in a big group, then we have a small committee that is going to engage with them from time to time, that those things were done. And I think where we've erred, there's a person we didn't speak to. I take full responsibility for that and will correct going forward. But from where I'm sitting and the facts we have, together with the mental health review board, we did everything to engage. Of course, there'll be one missing element here and there, and we take responsibility for that.
Now, I know that a lot of the patients are being relocated to non-governmental organizations and other hospitals as well. But there have been reports of deaths at some of these organizations, these NGOs that they're being admitted into. I mean, how safe are they? Where are you putting these patients? Do you know much about these NGOs?
Leanne, again, to put it on record, that these NGOs have been in existence for a long time. Out of the 122 NGOs where the mental patients are, only 14 of them are new, 14. The rest of them have been running the services from 2003, from 2005, from 2008, from 2010. They've been looking after mental health patients who are down referred from time to time by the likes of Randfontein, by the likes of Vescopis, by the likes of Tara hospitals, who deal with the extreme cases of patients and stabilize them. Once they're stabilized, they can refer to NGOs. As we speak, even before we refer these patients from Life, they were seeing plus minus 6,000 patients who were being looked after and were continuously being looked after by these NGOs. What we did, the NGOs then said, we have additional capacity to take more patients. We added those patients, but over and above that, there's only 14 new NGOs that have been established. Of course, this is part and parcel of ensuring that we get mental health closer to where the communities are. It's about ensuring that those NGOs, they have full capacity, they've got training, but they have the basic training, they've got the basic services. Going forward is to make sure that they improve for the better, because we are developing the community mental health. Answering the number of deaths, of course, we've heard that there are deaths in different facilities. To be specific, at the Precious Angels in and around Archersville. We are investigating those deaths because the numbers that we've been indicating, they seem to be very high. And on the basis of that investigation, because we have to do get postmortems done to understand what was the cause of death of these patients, but also to look at the files that we have, and the doctors were working at Life to understand where this patient extremely frail by the time they were moved there, and then all of that. So we're going to look at the history of the patients as well, do an investigation and be able to communicate appropriately. And our sincere condolences to all the families for what has happened. But our responsibility, Leanne, and I want to assure the public that the first thing we want to do, that these patients, we keep them in safe places. Where we find that the NGO is overstated their capacity and they are not able to do the work, we are able to take those patients, as we did just a few days ago in Gauteng, in Bramfisher, and the owner of the NGO is extremely happy. We've relocated them to decent premises in Randfontein.
All right, MEC, we've got to leave it there. I know there's lots more to talk about. Just finally, how many patients are we dealing with?
At 1,476 that we relocated,
okay.
91 out of those were taken by their families who said we want to take care of these family members.
Taken out of
yes, but also we're saying to them, if you've taken a family member, now you can no longer look after them. We're more than willing to take them back into the institutions.
All right, the MEC for Health here in Gauteng, Qedani Mahlangu, talking to us about this Life Esidimeni mental institution being closed down and the relocation of the patients to other institutions around the town. Thank you so much for joining.